Hey there, welcome. How's everyone doing? Dr. Erickson, EHS Physical Therapy and Chiropractic, along with
Brendan McNitt, physical therapist at EHS.
So Brendan and I want to talk about some common kind of symptoms that someone would have if you had a disc issue, right? So either in the lower back or the neck. Those are the most common, two places. The thoracic spine, or where the ribs attach, is very protected and very strong. You don't see as many there. It is possible, but we typically deal with ones in the lower back and the lower cervical spine.
Yeah. Basically, we're like you have the curves of your neck and your back. These areas are more vulnerable for disc injuries naturally.
Yeah, I mean, there's more mobility there naturally, which then allows for a little bit more chance of injury in that point or spot. So common disc symptoms, right? If you have that kind of thing, you can have what's called discogenic pain, or the outside layer of that disc, that annular wall, has nerve endings, is very highly innervated. And so when you have an issue with that, either a little bit of a bulge or a herniation, or maybe even a tear, possibly from a one-time thing, not as common as overuse over time things, but there can be pain that's very central, right in the low back, just off to the right or the left. The most common thing that people will kind of talk about is that radicular symptom, or that nerve root. Kind of explain what you'll feel with, let's just call it a lower back, like an L5, very common spot. What would somebody feel with that?
Right, so a common symptom of nerve pain in the lower back would be following like a pattern, like into the hip, down the leg. Sometimes people get it all the way down the leg, right, into the toes, into the feet. And that'll follow what we call like a dermatome pattern, like the nerve root kind of follows in the body a certain path. And it's pretty easy to spot that pattern if someone's having that pain. We can pretty easily spot that pattern, like, okay, it's probably a disc problem. It's probably causing some nerve root issues too. Let's talk about ways we can get that better.
So that's the easiest way to first kind of figure out if it is disc. There will be some certain characteristics, like you said, that the pattern at which it goes, the length of time which someone has had it. There'll be some mechanical blocks or some obstruction to movement. So hard to bend, or after you've been seated or bent, it's hard to get back up straight. You feel very stuck and very kind of. You could even be shifted to one side, and people are like, well, why are you off center, or why are you shifted? That's a definite disc issue. Those are very easy to tell. When there's a deformity, very easy to tell. But that's also why you probably don't have, like, I have a hip bursitis, I have a runner's knee, and I have some heel pain. I have three different things going on, or I just have a lower nerve root, like an L5S1, that goes all the way down to my heel or my big toe or my outside toes. So another way to find the disc. So what would be some things that you'd want to do initially if you have a disc injury, and maybe some things that we want to wait on until we get that cleared up and then work on?
Right. So like we were talking about earlier today too, you see people with disc pain, and they usually don't like to sit still. They usually don't like sitting down. Don't like standing still for too long.
They'll lean to one side.
Yeah, they like to change the way their body feels, and that's just kind of a natural thing to do. Like, you don't like the way it feels, so you move your body, right? So people like to walk, like to stay active. So things you can do initially is, first take note of when you're feeling that pain. Is it when you're sitting, when you're standing? Is it when you're doing stairs? Is there certain patterns in your day that you can modify to make your pain better? Is there certain
position, load, time of day, activity? What changes that symptom is the most. It's really gold for us to know if any of that stuff changes your symptom or pain or location. It's very important for us to help you fix it.
Yeah, then we can take that information and say, okay, here's your plan. We're going to have you just lie on your belly, or avoid sitting or stand or walk, things that promote activity and reduce your pain. And then we can kind of stair step from there and give you certain things you can work on, whether that's laying on your belly or doing certain stretches or doing certain movements and exercises to help centralize that pain, or say take it from being into my leg, into my hip, and just move it more up to the back. It's a pretty common progression we'll see with someone with the disc pain. They're going to get some soreness, some stiffness in their back, but should see some relief of symptoms in their leg and distally in the body. So using the signs of what you're seeing, follow those patterns of how it is in the morning, evening, or like what movements, sitting, standing, can help really determine what's the best treatment for you from there.
Yeah, that's the most important thing initially with the disc injury. If you don't have radicular symptoms, that's okay. Yeah. I mean, it can still be disc related, but there will still be those classic, what we call like a concordant sign, something that makes you feel better and worse. Time of day, position, load, whether it's sitting versus bending versus standing versus walking. There's something that changes it. It doesn't have to go away. It can even just wave in intensity, even if it's constant. But initially, if you would have any kind of referred symptom to the hip, to the leg, to the buttock, or anything like that. The most important thing, like Brennan said, is getting that first reduced in the furthest away part, bring it up. Once we get that, once we figure out, or once you figured out kind of what position or load does that, stay with that. That's right. Even if it hurts the back a little bit more, that's not a red light. That's actually a green light. You want to keep going with that thing. Once we get to that point, then we can start adding in or slowly progressing back and guiding you to some return to function type exercises and movements. And you got to stay active because of the blood flow issues back there. You want to keep active as much as you can. If anyone ever tells you to just rest, or here's get some medications and just rest, don't do anything, that's not the right advice. I mean, the resting typically will not solve the problem at all. It may calm things down temporarily because you're not moving, but you don't live your life laying down, and resting for weeks on end. That's not how you're not going to get back to being functional. Right. So those are some common disc-related symptoms, and then some common disc-related initial treatments that we would go through and kind of help you determine what position, what movement, what activity you should be doing, what position, activity, movement, or load that maybe you shouldn't be doing right now. Sure. And that's the hardest part, is that understanding what truly is better, what truly is worse. And there's a lot of gray and a lot of, we call it a yellow light. There's a lot of things that's like, well, it kind of increases pain a little bit, but when I stop, I'm no worse. It calms right back down. That's not wrong. That's not wrong at all. So stay with those right there. And then if you have any questions, let us know.